Yeah.
This meeting is being recorded.
Hello, everyone. A very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Excellence and Research Team at QurHealth. I welcome you all for today's webinar session on breast cancer. Early detection is the key to prevention. Our guest speaker for today is Dr. Veda Padma Priya. She is a surgical oncologist at MGM Hospital, Chennai. Firstly, for those who do not know about our company, QurHealth, I would like to give a brief introduction. QurHealth is a conversational AI company delivering personalized care at scale. At QurHealth, our vision is to save lives super proactively. Our mission is to improve patient quality of care, patient safety, patient adherence, and patient awareness. Our user-friendly app, QurBook, has more than 2,500 care plans and diet plans under 30 different health specialties. These plans will help to improve patients' health condition by monitoring lifestyle management activities, their vitals, symptoms, and which are specific to their disease condition. Our Care Concierge program consists of expert team of specialist doctors, dietitians, physiotherapists, counselors, and highly skilled nurses who are care coordinators. These care coordinators will remotely monitor your health condition through regular follow-up calls and make sure that you adhere to your care plan activities, take medication on time, and eat healthy food that is being listed in your diet plan. Recently, our newly introduced QurHome technology is an all-in-one at-home 24/7 bedside remote monitoring system. This is designed and developed specifically keeping in mind elderly patients. These are like elderly patients at home and patients with chronic conditions like cancer, diabetes, heart issues, kidney diseases, and so on. QurHome technology reverses the current way of at-home care. A patient need not do anything except to follow the extremely user-friendly and frictionless care plan regimen activities. Whether it is using a Bluetooth-enabled vital device or recording a symptom, calling a care coordinator, or even a family caregiver, patient just have to ask Sheila. And if you ask Sheila to do so, and it is as simple as using a remote to switch on a TV. So now let's begin our webinar session. Before I start, I would like to introduce our guest speaker for today. Dr. Veda Padma Priya is a renowned surgical oncologist with more than 15 years of experience. And she's currently working as a senior consultant at MGM Hospital, Chennai. She has completed her MBBS from Coimbatore Medical College. She did her MS in general surgery from Madurai Medical College and DNB in surgical oncology from Rajiv Gandhi Cancer Institute and Research Center, New Delhi. Her expertise includes various techniques in breast oncology, such as sentinel lymph node biopsy, breast conservation surgery, axillary surgery, prophylactic mastectomy, modified radical mastectomy, skin sparing mastectomy, oncoplasty, breast reconstruction procedures, and so on. She's also the author of various books, guides, and publications of national and international repute. She is a keen advocate of patient support groups and has organized many national and international conferences. We are very honored to have you with us today, Dr. Veda.
Thank you. And very good evening to one and all.
I would like to inform all the viewers that you can type your questions in the comment section, and these questions will be answered at the end of the webinar during the Q&A session. So let's begin our webinar session on breast cancer. As you all know, that breast cancer is the most diagnosed cancer and the leading cause of death among women worldwide. According to World Health Organization, in 2020, there were about 2.3 million new cases of breast cancer globally, and about 685,000 breast cancer deaths. Worldwide, female breast cancer has now surpassed lung cancer as the most diagnosed cancer. Increased awareness and knowledge of breast cancer and breast cancer screening are very important, as early detection can diagnose the disease when it is at a most treatable stage. This webinar especially provides a detailed insight into early symptoms of breast cancer, screening, treatment, and lifestyle changes, besides trying to reduce the fear of breast cancer among women. So, Dr. Veda, please brief our audience about early warning signs and symptoms of breast cancer and the right method of performing breast self-examination.
Okay, so before we go into the details of signs and symptoms, the first message that I want to give everyone is you don't have to wait for symptoms to develop. Not only in breast cancer, it applies to any other condition. What people think is, I don't have any symptoms, then how can I have this? So the thing is, any disease has a pre-symptomatic or asymptomatic phase when they have the disease in the body, but they do not manifest it as signs or symptoms. And then comes a phase where the disease burden increases, and then you develop signs and symptoms. So that is a clinical phase. And like I said, we don't have to wait for symptoms to develop to detect it. We are in an era of, like in 2022, suppose you need to go to a place, we use a GPS, we see what is the traffic condition, we see what is the weather condition to understand and plan to go to an event or to go through which route. So when such technology has aided us in our day-to-day life, I think it is wiser for us to incorporate that technology for our health issues also. So, having said that, we also have to know what the common signs and symptoms of breast cancer are. And the most common symptom for breast cancer is a painless lump. Okay, so any when we were doing our MBBS courses, in fact, we used to be taught that any lump in the breast beyond 40 years of age, it is like number one, number two, number three possibilities is cancer, cancer, cancer. And you have to prove it. That is, you have to take it as cancer unless and until otherwise proved. That is, you have to prove or disprove whether it is cancerous or not cancerous. So that is the index of suspicion in a breast lump in a woman after beyond 40 years of age. So the same rule applies now also. In fact, now the age criteria has been taken out. Even though the most common lumps in younger women are not cancer, in younger women can also develop breast cancer. In fact, India has the highest number of young women with breast cancer. So any breast lump has to undergo a triple assessment. So most of the lumps are painless. So apart from lumps, any changes in the skin in the breast and the adjacent area, any discharge in the nipple, could be serous or like watery discharge, especially when it is mixed with blood, then the index of suspicion is high. Then what we call it as indrawing of the nipple or recent retraction of the nipple, that means that there's something below the nipple that is pulling it down, and that could be cancerous. Okay, so skin changes like dimpling or tethering, just like nipple is indrawn, the skin can be indrawn, so that's called a dimple, like what you have on the face when you smile. So the skin goes in. So a spot of skin over the breast goes in, and it's called dimpling. And it is a patch of skin that goes or is like hard, it's called tethering. So dimpling, tethering, then retraction, then any changes, crusting in the areolar parts of the skin, any lump in the armpits, or all these are signs and symptoms of cancer. One more important sign is what we call there is no lump in the breast, but the entire breast is swollen. It's all red, and you can see multiple pitting, like a orange skin peel appearance called podrange. So all these are the basic signs and symptoms for breast cancer.
Okay. So how do you suggest, doctor, like for every woman, if they have to perform a self breast examination, what are the steps they need to follow?
So yeah, so coming to breast self-examination. See, earlier they used to advocate breast self-examination as a screening modality itself. Okay, later they withdrew it as a screening modality because it was very subjective and there was no objective method. Because the way one person does a breast self examination may not be equal to the way the other person does, and the texture and symmetry of the breast varies from person to person, and that is why it was taken out of the screening modality. But despite that, it is one of the most useful methods which everyone can do. So the first step towards breast cancer is everyone has to be aware of what is normal. So every woman has to be aware of what is normal for her and for others. What is normal for her may be abnormal for another person. Okay, so what is normal for her, you need to be aware. And how to go about it? You start with breast self examination. So breast self examination is basically inspection. Inspection means is looking in front of the mirror, and palpation is when you feel it with the hand. So inspection and palpation of the breast, which has to be done on a regular basis, that is on a monthly basis. In women who have their periods, it is ideal to do it 1 week after periods when the entire breast is supple. And for postmenopausal women, that women who've completed their periods, they can choose any day of the month and keep repeating it every month. Okay, and ideally it can be done at the time you shower or just after shower, or in the night before a shower. Okay, and the various positions we say is like you stand in front of the mirror. Standing position, sitting position, both are accepted, but what is more important is hands by the side, hands on the hips, and hands above, raised above. These three positions are very important. So you need to look into changes in the breast in all three positions, because sometimes if the breast is heavy, smaller lumps below the breast or in the inframammary crease can be missed out, and these can be easily picked up when you raise the hands overhead. Okay, and raising the both the hands overhead also, like suppose there is a small dimpling or tethering, it will become more obvious. Sometimes lumps become more obvious when you raise the hands. So that position is very important when you look in front of the mirror. Also, not only the breast area, like I told you, the neck and the armpit are also related areas, so those areas also have to be inspected. Then coming for palpation, for feeling, it is better in sitting position. It is difficult, so we say okay, you can lie down and then feel through the various areas of the breast, because when you lie down the breast goes flat. Okay, and then you have to feel with the flat of the fingers, the four fingers as a flat. You should not try to pick up, because when you pick up breast tissue, you will feel like lumps. So basically with the flat of the fingers, what you call it as superficial palpation, the breast is actually taken as a like a clock. So you have four quadrants. So you start with one quadrant, it is like 12 to 3 o'clock, 3 to 6 o'clock, 6 to 9, and 9 to 12 o'clock, and then the nipple areolar complex. So you go around with just rolling movements across all the quadrants and then across the nipple areolar complex. So this is superficial palpation. If there is something abnormal, you will find something coming and hitting your hands. And then you have to do a deeper palpation at that area to see if there is a lump and what are the characteristics of the lump. Okay, and at the end of the things, you will have to press the nipple and see, especially the nipple and the base of the nipple, to see if there is any discharge. So many videos are available, of course, on the net as to how to go about doing a breast self examination. The first time, many of them may not be able to. When you do it regularly, you will understand it. And the first thing is you have to understand what is. In fact, what we used to do is we used to have these workshops where we had breast dummies, and they used to have like mannequins. We had dummies, and one breast was normal and the other breast had some lump like sensations, so that people can feel and understand how a lump looks like. So unless and until they know what it looks like, it will be very difficult for them to find out when they do a breast self examination.
Okay. So when in doubt, it is good to meet the oncologist and take
Yeah,
doctor's advice.
definitely. Whenever in doubt, please meet the oncologist. Okay.
And also, doctor, most of the oncologists agree that diagnosing cancer early before it has spread is the key to successful treating the disease. So when it comes to breast cancer prevention, how important are these routine annual screening tests, and what kind of breast cancer screening tests are available presently, and at what age should a woman take up these screening tests?
So like I told you, like we don't have to wait for symptoms to develop, because by the time you feel a lump, it's almost like 2 centimeters in size, and that becomes like anything more than 2 centimeters is stage 2. So it is already stage 2 by the time you feel it. Okay, so and screening is advantageous that it picks up cancer even in at a time when it cannot be felt, that is in either stage 0 or stage 1. So the screening modalities for choice for breast cancer is two. One is the clinical breast examination. So clinical breast examination is basically a physical examination, but it is done by a healthcare provider who is trained in it. So it can be an oncologist, it can be a doctor, it can be a nurse care practitioner, or it can be a community health worker, but they are trained to do that. Okay, and so that is very important, because in a country like India, where mammograms are not easily available in on the rural setups, and of course, even if we do mammogram camps, mammo buses and all that, it's difficult to cover the entire population. Then clinical breast examination is a very easy substitute that can be that can cater to the vast majority of the Indian population. The second modality, that is screening modality of choice for breast cancer, is a mammogram. So mammogram is basically an X-ray of the breast. So screening is basically a test, a regular test or medical checkup that is done in the normal population. Okay, it is not done in people who have symptoms. Like during the COVID, we saw like every next person or every person who has to enter an airport or a railway station or a mall has to undergo thermal screening. They will check the temperature. If the temperature is normal only, they will allow you. It is still there in many of the places, irrespective of whether you have fever or cough. So that is called screening. Whereas if you have a symptom, if you have cough or if you have fever, then they would do a COVID testing, an RT-PCR testing, to know whether you have COVID or not. So that is a diagnostic checkup. So similarly, in a mammogram, a screening mammogram isn't done in the normal population. So any woman beyond 40 years of age, it has to be done on a yearly basis. And if at all anybody has a breast lump, then screening mammogram is not the choice. Then you have to do a diagnostic mammogram. Then it is a different view, and you might have a spot compression or spot magnification.
Okay.
So, a mammogram has to be done regularly. There is no substitute for it.
Okay, doctor. And research has also shown that the risk of breast cancer is due to combination of various factors. So according to you, doctor, what are the factors that increase the risk of breast cancer, and who is prone to get breast cancer?
So again, there's another point that I want to add in this. See, many of the cancers have something called a causative factor. You can you can pinpoint to one particular factor and say that this is the reason, causative factor. For example, if you say for lung cancer, we say that if you smoke tobacco, then tobacco causes lung cancer. So there is a direct correlation: smoking, tobacco, and lung cancer. So smoking causes lung cancer. Whereas in breast cancer is unique that you don't have any causative factor. Okay, it's difficult to pinpoint that this is the reason you develop breast cancer. But there are multiple risk factors which increase your risk for developing breast cancer. Okay, and these risk factors are important because some of them are modifiable, that which is under our control, and some of them are unmodifiable. So we'll split it into modifiable and unmodifiable. It's very important to understand the unmodifiable risk factors also. Then only we will understand what our risk is. Unless and until we know our risk, we cannot take steps to combat breast cancer. So in fact, in many of the awareness sessions that I take up recently, I've been asking this question across the across the strata, because not many are aware of these factors. Okay, any person would be actually shocked to know that the most common risk factor in breast cancer is gender. I'll say being a woman is your risk factor for breast cancer.
Yeah.
And majority of our women or men of the public people do not know this. Even many of the doctors also don't know this. Unless and until you are somewhere related to oncology, you would not think of it and you would not understand it. So it is very important. So gender, age, race, all these three are risk factors which are beyond our control, so unmodifiable. Whereas there are factors which are under our control, like hormonal factors. Majority of breast cancers are hormone dependent, so hormonal factors have a huge play. And when we say hormonal factors, like having early menarche, that is the age at first periods, age at first childbirth, late menopause. If the age at first periods is less than 12 years, it increases the risk for breast cancer. Late menopause is beyond 55 years. If you're having your periods, it is a risk factor for breast cancer. All simply because it increases your exposure to estrogen. Then not have pregnancy is protective, so not having children is a risk factor. But as ironically, having your first child beyond 35 years of age is riskier than not having children at all. And this is one point which is very important to the present generation, because now the age at marriage is actually especially when with careers, women working in all fronts, the age of marriage is actually increased. Okay, and after marriage also people have started thinking to plan the family. And if you're not aware of this physiological fact that if you're going to have delayed first child, then there is an increased risk of breast cancer, then then you will be at a soup. Okay, so delayed age at first childbirth, then having hormones like birth pills for a long period of time, or hormone replacement therapy for years together, increases your risk for breast cancer. So these are hormonal factors. Then lifestyle factors. Again, this is very important, because lifestyle factors is what a triad, what I call a triad. Basically, diet, what you eat, then what you do, physical activity, and your weight or obesity. So this is a triad, and this has to be in a balance. If this balance is not there, then your weight increases, and the imbalance of these three is responsible for majority of the lifestyle diseases today, not only breast cancer. Okay,
Yeah.
apart from this, another risk factor which is important, that is having a strong family history. 10% of them of breast cancers are hereditary.
Doctor, I think your voice is breaking. There's some
Yeah.
disturbance. Okay. Yeah.
Can you hear me now?
Yes, doctor.
So, in 10% of women, the breast cancer can be hereditary, and for them, having a genetic mutation in their genes is the biggest risk factor for developing breast cancer.
So, doctor, as you rightly mentioned, that women who never had a baby have the increased risk of breast cancer. And also in recent days, most of the women undergo treatment for conceiving, which majorly includes hormonal medications.
Yeah.
So many women have this question, like, do these hormones trigger breast cancer?
So, before workup for infertility, we need to have a baseline mammogram. Okay, and like I said, breast cancer is majority of breast cancers are hormone dependent, and so treatment for infertility. See, if it's just one cycle or two cycle, I don't think it's much of a problem. But some people undergo repeated inductions and repeated attempts at fertility. Then there are instances where we've had people undergoing fertility treatment, and then they come to us with a lump which has recently increased in size, and we find that it is breast cancer.
Okay. And also, Doctor, recently I read an article in Economic Times, which was mentioning about PABC, that is pregnancy-associated breast cancer.
Associated breast cancer.
Yeah,
See,
this has
nowadays we can
yeah.
Nowadays what happened is we have more younger women having breast cancer. Okay, so in India, compared to the West, all over the world, 7% of the women with breast cancer are less than 40 years of age, whereas in India it's to the tune, it's almost doubled, it's up to 15%. Okay, and because there is a delayed age at the first childbirth. Okay, nowadays first child is like after 25-30 years. Okay, so again that the hormonal milieu is so much changed, so there are a lot of women with pregnancy associated breast cancer. That could be during pregnancy or just after pregnancy, because what happens is during pregnancy the amount of hormonal changes is very dynamic.
True.
So, and breast is a very sensitive organ. Okay, so most of the peak incidences are either associated during pregnancy or during menopause.
Yeah. And also,
There
Doctor.
are two peaks.
Yeah.
So one peak is just after menopause, and one peak is just after a pregnancy.
Okay.
But pregnancy is definitely protective. Okay.
Okay. And also, Doctor, approximately 1% of breast cancer cases appear to be among men. And most of our audience would not know this information. And I would like you to please explain our audience how vulnerable are men to be affected with breast cancer, and what are the causes of breast cancer in men?
So this is very important. Like I told you, gender is definitely a risk factor for breast cancer, but that does not mean that breast cancer cannot occur in men at all. So 1% of breast cancer occur in men, and the thing is, in them they don't suspect that this could be cancerous, so they don't usually understand that this symptom could be because of breast cancer, and because of that it is a delayed presentation and they are picked up, and because the volume of breast is very less compared to the female breast, so the stage is advanced at presentation. Okay, and majority, or in fact literally all male breast cancers means that they have a hereditary predisposition. So we are supposed to do a genetic testing if there is a male breast cancer in the family.
Okay. And as you also said, Doctor,
in fact we've had requests from our patients, from a male breast cancer patient who said that he wanted to undergo prophylactic mastectomy. I said it is not like prophylactic mastectomy as of now is for the females, not for the males. But again, like we need to discuss the risk with an individual patient.
Yeah, true, Doctor. Like you already mentioned, Doctor, that overweight and obese women are at higher risk of breast cancer, especially after their menopause. Does losing weight lower the risk of breast cancer? And does weight loss after cancer diagnosis will be beneficial to these patients?
So there are two things. So postmenopausal obesity is a risk factor. So any weight loss is, or weight reduction, I wouldn't say weight loss, it's a weight reduction. Okay, weight loss is when you don't understand why the loss is happening. Okay, so a programmed weight reduction is definitely useful, not only in reducing a risk for breast cancer, but in multiple other like in maintaining your health and improving your overall health as well. Because physical activity, lack of physical activity is responsible for your cardiac diseases, for your breast cancer, for not only for breast cancer, for multiple other cancers. And obesity causes a lot of morbidity. Okay, and even patients who've had breast cancer treatment, we ask them to undergo a weight loss challenge, because weight reduction after treatment reduces the chances of recurrence. Or if you gain weight after treatment, that means your chances of recurrence is much more.
Yeah.
So a weight loss challenge is usually incorporated for people who have underwent a breast cancer treatment.
Okay. And also, Doctor, there is no proven way to completely prevent breast cancer, but we can surely reduce the risk. For women who are
Yeah.
known to be at increased risk of breast cancer, what additional steps can they take to reduce the risk of developing this breast cancer?
So for reducing the risk is like adopting healthy lifestyle choices. Okay, so one is what you eat. Okay, what you eat is very important, and weight reduction, improvement in physical activity. So basically, you have to half your intake. Whatever you take, just reduce it by half, and whatever physical activity you do, you double it. That's a easy formula, so that you don't gain weight. And these are the most important risk factors for breast cancer also. Apart from this, to reduce your risk is some of the like hormonal factors, external hormonal factors like hormone replacement therapy or birth pills should not be taken on a long term propagator. Third factor, risk factor, which I would say is like addictions, like healthy lifestyle. So even alcohol, even one drink of alcohol a day is supposed to increase your risk for breast cancer. So you have to avoid addictions, so which increase the risk for breast cancer. Okay. Fourthly, is risk reduction strategies in a that may not be applicable to the normal population, but those are risk reduction strategies in a high risk individual. Okay, a person who has a strong family history or who is found to be positive with a genetic mutation, then their risk for breast cancer is enormous. So in them, we have different strategies to reduce the risk, including some medications and some surgeries.
Okay. And although breast cancer mostly occurs among older women, we know that women of all age groups nowadays are at high risk of getting breast cancer. If a younger woman has breast cancer, does it affect her fertility? Can she have a baby after being diagnosed with breast cancer?
So this is again very important because nowadays, like I told you, the percentage of younger women with breast cancer is high, and especially because of delayed childbearing, your treatment parameters and fertility becomes a concern. Okay. Earlier generation, we used to have like by age 25, they would have completed the family.
Yeah.
Now the present generation, the family does not start by not even by 25 years. Okay. Like why I'm telling you this is, see, we had I just share an anecdote. So one patient, so basically she was a mother of two children. She had ovarian cancer. She had two daughters. The elder daughter was 40 years, but she had completed family. And so the other daughter, she was young and she was just married. Okay. And so the mother had ovarian cancer. Then the younger daughter developed breast cancer. Now the elder daughter had. So when they found out, did a genetic testing, they found all three were BRCA positive, and the elder daughter then underwent a prophylactic oophorectomy because she had already completed her family. The second, the younger daughter was just married, but the elder daughter had completed her family by then. Okay, so we were able to do those risk reduction strategies at that point of time. But again, if there's a delayed childbearing, then fertility becomes a major concern. She wouldn't have completed family by that point of time. Okay, like the younger girl, she was just 30 and she was just married, and she was diagnosed with breast cancer. So fertility again definitely becomes a concern because your treatment modalities definitely affects fertility. One, second, after breast cancer treatment, you give, suppose they are hormone dependent, you give um, selective estrogen receptor modulators for 5 to 10 years. So then you need to give a gap in treatment to accommodate pregnancy. So there are multiple things that have to be taken into consideration. So any patient who's undergoing treatment for breast cancer, especially chemotherapy, we have to suggest them a consult with a fertility specialist. So they have to undergo consultation with a fertility specialist if they have not completed family. Okay, and of course there are multiple methods of how to maintain fertility or how to go about pregnancy, but that's a totally different this thing. At least a fertility consult has to be done at baseline, and some fertility preservation strategies can be adopted to maintain fertility.
And also, doctor, there is fear among many women that pregnancy can cause the recurrence of breast cancer. Is it true that pregnancy or breastfeeding makes breast cancer come back? Can women breastfeed safely after breast cancer?
See, after you have breast cancer and you've completed treatment and you're disease free, okay, suppose you are ERPR positive, then pregnancy and lactation is one like one event where your estrogen exposure becomes higher.
Yeah.
Okay, so that is why we need to give a good safe amount of time after breast cancer before we can accommodate pregnancy. Okay, there is no like you cannot say again, it's a call that the patient has to take. Okay, because we just cannot say, yeah, definitely the risk increases. We have to balance it with fertility and then take it ahead.
Yeah. And also the studies have shown that 5 to 10% of breast cancers are mainly linked with the gene mutations, and some are inherited from one's mother or father. Who should get genetic testing done for breast cancer?
Okay, so the point I had already told was that 10% of breast cancers can be hereditary. That means they are passed on from one generation to another. So there are basically some mutations in the genes, and these genes can be passed from grandparents to parents and parents to children. So when this pattern of inheritance is seen, then it is called hereditary cancer, and hereditary breast ovarian syndrome is one of the commonest things which can happen. So it can come from either the father's side or from the mother's side. So there are certain candidates which in whom genetic testing should be considered. So any young patient, like breast cancer in a young patient less than 45 years of age, we consider genetic testing. Any male breast cancer, we consider genetic testing. Any patient who has a strong family history, either from the mother side or parent side, then we consider genetic testing. Apart from that, triple negative breast cancers in younger women, again, that is the criteria for genetic testing.
And as you already mentioned about prophylactic mastectomy, which is one of the recent and growing strategies for breast cancer risk reduction. According to you, is it a good option, doctor, for women who are at high breast cancer?
So, see, the thing is, what you have to understand is it's a very personal choice. Okay, that's why when Angelina Jolie wrote about it, she said, "My choice, like it's my personal choice." Okay, it's how you look at it.
When you have a strong family history.
Your voice is breaking again.
Yeah.
Is it okay now?
Yeah.
So when you have a strong family history and you have a mutant gene that is capable of that has come to you from either your parents, and it is capable of passing to your children also, then somewhere down the line you feel that you need to take some action on it. Okay, so like for Angelina Jolie, what happened was she lost her mother and her maternal aunt, that is mother's sister. Both of them, they had breast and ovarian cancer, and both of them died because of cancer. So that itself had a trauma on her. And when both of them were positive for BRCA mutation, and when she tested herself, she was also BRCA positive. So there are some models which calculates your risk for breast cancer. Okay, and they found out that her risk for developing breast cancer, because she was young, okay, she was around 36, and over the next 40 years in her lifetime, risk was to the tune of about 80 to 85%. Okay, and when you're given with such an information, you would want to understand what are the reduction strategies available. And there are reduction strategies available, but the best reduction strategy available is a prophylactic mastectomy. Okay, because when you undergo, and this mastectomy, prophylactic surgeries, it can be either be a mastectomy or an oophorectomy. Okay, so a mastectomy helps only when the woman is, or the maximum benefit is when she's less than 45 40 years. Okay, there is no fun in doing a prophylactic mastectomy in a 65 or 70-year-old, because they've already lived the majority of their life without cancer. Okay, so but again, I would say it's an individual choice. Okay, what is more important is a prophylactic oophorectomy, because at least for a breast, we have some screening techniques that can pick up breast cancer early, whereas for the ovary, we don't have, like, the earliest we can pick up a stage 3. There are no screening modalities. So prophylactic oophorectomy is actually more useful than a mastectomy. But what happens is, because of the hype, a lot of people are behind mastectomy than oophorectomy.
Okay. And Dr.
But what we have to understand is, despite all reduction like mastectomy, does not mean that your risk is 0. There is a baseline risk. A 5% risk always remains. There is a 95% risk reduction. 90 to 95% risk reduction is what we are looking at. So if she had an 80 or 85% risk, it is reduced to, let's say, maybe 5% baseline.
Okay, doctor. And also, doctor, let our audience know about what are the treatment options which are available for breast cancer based on the type of cancer and the stage of cancer. And also, how effective is the adjuvant therapy for breast cancer?
So as of now, the various modalities for treatment is like, you include surgery, then you have radiation, you have chemotherapy, you have targeted therapy, you have hormonal therapy. Okay. Now, all of them may not be required for everyone. Okay. If it's an early breast cancer, definitely they will require surgery, and depending upon we call, like, there are 4 various types, major types of breast cancer based on the receptor status. So whether they ERPR or hormone receptor positive, whether they are HER2 receptor positive. So based on that, if they are hormone receptor positive, they will require some sort of a hormonal manipulation. If they are HER2 positive, then they require a targeted therapy. Okay, and if they are negative for all, then definitely they will require chemotherapy. Okay, and radiation is a local modality of treatment, especially when you save the breast. Radiation is definitely required. And so I think those are the various modalities of treatment, and all of them, see, in 2022, the entire gamut of treatment options have changed, and it's no longer necessary that everyone, like, see, 10 years back, 10, 15 years back, any woman with breast cancer, they had to undergo a mastectomy or removal of the entire breast. So it is not so. It's like, it's for the past 15 years, it's been like, we've been able to pick up early cancers, and whenever possible,
conservation surgery.
Okay. Like you already mentioned, doctor, like triple negative breast cancer, this accounts for almost 10 to 20% of all breast cancer cases. So most of our audience do not know what is triple negative breast cancer, and who are at high risk of this type of breast cancer.
Okay, so like I told you, there are 3 factors. One is ER, then PR, and HER2. So ER is estrogen receptor, PR is progesterone receptor, and HER2 is human epidermal growth factor receptor. So if all 3 are negative, then we call that group as a triple negative subgroup. Okay, and triple negative subgroup is supposed to be an aggressive subgroup, and because they don't have any targets, like they are not responsive to hormones or targets, so chemotherapy is the only option. Okay, the other group is luminal A, is when ERPR is positive and HER2 is negative. That's the majority of the women, and they are supposed to have a good tumor biology, and the outcomes are much better.
Okay. And in general, what are the recent advances in breast cancer diagnosis and treatment, doctor? So how has the success rate of breast cancer treatment changed in the past few years?
Yeah, definitely the treatment, like I told you, the earlier the stage, the better the treatment options, the better the treatment outcomes. Okay. Nowadays, we do get a vast majority of Indian women in stage 2. So initially it used to be stage 3. Stage 3 means the only 50% make it beyond 5 years. Okay. But now we do have a lot of people with stage 2. That means around 80 or 85% of the people live beyond 5 years. And see, for all cancers, when we talk about cure, it was to 5 years. Okay, but for breast cancer alone, it's improved. You have to, it's no more 5 years, it's no more 10 years, it's no more 15 years. We're talking about 20-25 years survival. And that's a huge leap.
Yeah,
Okay.
true. And also it is a well-known fact that immune system helps us in the prevention and fighting of cancer. So how to boost the immune system after treatment and recovery from breast cancer? And what is the best diet to be taken to prevent breast cancer?
Okay, so it's not only for breast cancers, for all cancers.
For all
See,
of
immunity,
cancers.
that's why. See, that is why immunotherapy has come up,
Yeah,
because see, cancer is not something like an infection, but it is something within the body. See, in
yeah,
our body, all the cells are in a balance, and when this balance is ticked off, then cancerous changes occur in the body. So our immunity plays a major role in preventing cancer. Or see, what happens is there are genetic mutations that occur in our genes day in and day out. So we do have repair genes that take care of all these things. Okay. So the problem is when there is an imbalance, when the repair genes are not able to are overburdened with the number of mutations, then these mutations form or change into cancer. Okay. So when we boost the immunity, then they will keep that in a balance. So this is very important. So definitely our exposure to, see, what causes cancer. Again, a lot of things. It could be chemicals, it could be physical, it could be radiation, and it could be also exposure to these things have to be less, including our food preservatives. That is very important, because the way we eat has changed dramatically over the past 20-25 years. What our parents ate and what we eat is totally different. Okay. We are the food processing industry and has actually changed the way we eat. We are not eating anything fresh nowadays. This is like all processed and stored. So when the problem with processing and storing is they add chemicals. So they add chemicals as food preservatives. And if you look into the WHO list of carcinogens, that is cancer causing substances, or safe ones, you find that none of these food preservatives come into the safe category.
true.
Okay. So so that is very, very important. Okay. So
Because like hair dyes, the cosmetics, because see
Your
like some
voice,
people,
your voice is breaking, doctor, again.
yeah, like chemical.
chemical exposure like hair dyes and
No,
cosmetics.
it's still breaking, doctor.
Okay, 1 minute. Is it better now?
Oh, no.
No, what?
Yeah, now it's
I
better,
think
doctor. Yeah.
yeah. So the thing is, your like cosmetics and dyes, which we do on which we use on a day-to-day basis, again cause genetic damage. So anything that causes genetic damage is not okay. Okay, be it what you eat, what you drink. Okay, tobacco. Tobacco again is responsible for 2/3 of the cancers of the world. Okay, so smoking, alcohol, both are known carcinogens. Apart from that, food processants, food preservatives, cosmetics, dyes, plastics, radiation. So, reducing the exposure to all of these is very important. Okay, and from our body point of view, keeping a diet rich in immunity. So, what we call it as a rainbow diet. Okay, so rainbow diet basically is fruits and vegetables in the color of the rainbow, because those are rich in antioxidants and that help us boost our immunity and actually prevent cancer.
So, doctor, one last question. And in most of the
Yeah.
cases, the recurrence of cancer is very high. So usually which type of breast cancer the recurrence is high, and how often should a follow-up be done post breast cancer treatment?
Okay. So again, recurrence will depend upon the stage. Okay. The higher the stage, the higher the chance of recurrence. Okay. And similarly, the aggressive the biology, whether it is HER2 or triple negative, then higher the chances of recurrence. So that is very important to note. And so that is why after completion of therapy also we need to be on regular follow-up. And the first 2 years is the most crucial period where the highest number of recurrences have been reported. So we call for early checkups or frequent visits during the first 2 years, and after the first 2 years then you de-escalate, you call once in 6 months, and after 5 years you become like normal, so you're called once a year.
Okay. Thanks, Doctor, for that elaborate briefing during the webinar session. So now let us move on to the audience questions. So there are a few questions from our audience side. Okay, so I'll just pick up one by one. One of the audience has asked, like, she's being advised to undergo breast MRI, and she's in doubt how accurate is this breast MRI when compared with the mammogram.
Okay, so one thing is, see, the mammogram is the screening modality of choice. Okay, but in certain women, MRI has an advantage. Okay, in women less than 40 years of age, the sensitivity of the mammogram comes down. In women with a strong family of history, again, MRI has an advantage. Or women with a dense breast, MRI has an advantage. Okay, but as a screening modality, the caveat is MRI is costlier, it is not available widespread, and it picks up everything and anything. So then it confuses the doctor as to whether you need to chase everything that is picked up on the MRI.
Oh, okay. And one of the audience is asking, I'm 48 years old. I have no history at home of any breast cancer. I didn't go for any checkup. Is it necessary that I need to go for checkup?
Yeah. So the dictum is anybody beyond 40 years of age have to undergo an annual mammogram. So it's okay beyond 50 years of age, but now they have revised their guidelines. In India, we used to have younger women, so we used to say 40 years. And now the American Cancer Society, in fact, has revised their guidelines and have included that mammogram should start at 40 years of age.
Okay. And one of the audience, she's asking, she has been using birth control pills for 1 year. And do these oral contraceptive pills increase the risk of breast cancer?
So there are two things that we need to know. See, oral contraceptive pills, the recent pills have both estrogen and progesterone. The previous generation one used to be high dose estrogen, which no more is available in the market. But any birth control pills over a long period of time, 1 year is not a long period of time, but I would suggest that they shift to another kind of contraception, because over years you're increasing your hormonal exposure, which might increase your risk for breast cancer.
Okay. And also, doctor, there are various myths about breast cancer. Likewise, one of the audience is asking, is it true that higher intake of milk and milk products, is this linked to increase in breast cancer?
This is very, very important. Actually, in 2015, there was a controversial statement from the US again, which said that drinking, just like they said, drinking 1 glass of alcohol is associated with the risk of breast cancer. They also came up that drinking milk also is increases the risk of breast cancer. Okay, but what I would suggest is but there's no scientific basis for it, because what happens is for generations we've been having milk. The problem is not about milk. The problem is about the dairy processing. The way dairy is processed is totally different from what it was previously. Okay, so you cannot, it's a confounding bias. So that does not mean that having a milk should relate to cancer. because like I told you, food processing industry have changed a lot. The dairy processing industry has also changed a lot. Every cow that produces milk is being injected oxytocin to produce that milk. You're given shots of hormones. Okay, we really don't know. Okay, we really don't know what is the safe amount of hormones we can be exposed to.
Yeah, true.
Okay.
True, doctor. And one of our
So
audience,
what I would suggest is, instead of avoiding milk products, you reduce the amount of fat-free milk is okay. So basically, we say it has to be fat-free and, if possible, organic.
yeah.
Okay.
And the audience is asking, like, she has been using cosmetics and hair dyes since her college days, and is this linked to higher risk of breast cancer?
Not increased risk of breast cancer, but it usually skin cancers and other cancers are is related to hair colorants. So it's very important. Recently, we had an article which came up in the paper which said that this hair straightening chemicals is
Brightness.
associated with uterine.
Uterine cancer. Yeah.
It's associated with uterine cancer. Okay, so it may not be related to breast cancer, but bladder is something again related to pains and dyes, and uterine cancer again with hair straightening chemicals. And now what happens is, initially women used to, not even men and women used to have hair dyes when the hair grays out. But now it is like from early they are exposed to hair colorants when they've not even
They
so
just
when they're
want
not even
for, yeah,
even
for
before 18
fashion
years
they
of,
do it.
even before 18 years of age, even before 18 years of age, they are exposed to hair colorants.
Yeah.
Okay.
Yeah, they want to try out different colors. Yeah. Okay. Okay,
Yeah.
doctor. One of the audience is also asking that my sister-in-law got breast cancer at age of 72. Now she is recovering, and are there any chances of recurrence? This is one of the audience who is asking this.
So that depends on the stage. So that depends on the stage. See, at 72 years, see, life expectancy we take around 75 years. Okay. So if it's a stage 1, stage 2 breast cancer, practically we don't expect any recurrences if they have completed the entire treatment. Okay. So the only thing is, if it is a higher stage with incomplete treatment, then there's a chance of recurrence.
Okay. Okay, doctor. So I'll take up one last question from the audience. So she is asking, like, mammogram is usually advised on a regular basis annually. Is it safe for doing mammogram test twice in a year?
So normally we don't do mammogram twice
A year. We say once a year is more than enough. But in certain circumstances where any lesion is there and it cannot be followed up on an ultrasound, we suggest a short follow-up with a mammogram. But normally we don't advise mammogram twice a year.
Okay, so once in a year is more than
once a year is a norm. Yeah.
Yeah. Okay. And also, doctor, if they detect any kind of lumps, what is the next step that the patient should be doing?
So any lump in the breast, it has to undergo a triple assessment. Triple assessment means it has to be seen by a doctor preferably a surgeon or an oncologist and not a gynecologist, please. And second is ultrasound of the breast, either an ultrasound or a mammogram. So basically breast imaging, because if it's more than 40 years, mammogram, less than 40 years, an ultrasound. And then the third part is it has to undergo a needle testing. So needle testing means a needle biopsy.
Biopsy.
And not an. So a triple assessment is the gold standard for breast lumps.
Okay. Thank you very much, Dr. Veda, for creating awareness among our audience about breast cancer. I'm sure that today's viewers would have got enlightened, and every woman will surely be aware of what they can do to be proactive about their breast health. And also, dear viewers, To avail the benefits of our care plans and diet plans, along with the care coordination services, please download QurBook app from Play Store. As I already mentioned, we have more than 2,500 care plans and diet plans under 30 different health specialties. So you can make use of all these benefits and our services. We have also introduced post-chemo and post-surgery care plans and diet plans for breast cancer patients, especially who have undergone surgeries. We will be very happy to serve you and your healthcare needs. Kindly contact us for subscriptions and any queries. Thank you very much, Doctor. And thank you all for joining today's session. Take care. Bye.
Yeah, thank you and bye.